Non-invasive ultrasound. It's designed for 4 different modalities. 1, skin tightening. 2, areas of some excess fat called adiposities. 3, for cellulite improvement. And 4, for overall removal of circumferential fat from the body. We measure down to a point where we can be reproduced, which is his rib cage. So this is going to be the upper part of the abdomen. So right now it looks like it's about 90.3 centimeters. Okay. Now what we're going to do is we're going to go right above his hip bone there. So if you feel the hip bones, that's going to be the second measurement, and then we'll just pick a point halfway between there. That's your hip bone. Okay, so it's about, something's about 90. Hear that? Okay, so it's about 90 centimeters. Halfway between those two. Okay, so that's about 92. Do you agree? It's about 92 centimeters. The machine to my left is called the MC1 or VaserShape. There's 2 modalities to this. One is called the ultrasound handpiece, and one's called the zonal massage handpiece. The theory behind this non-invasive, so we don't have to do surgical therapy, it stays on the skin and does not go inside the body. This non-invasive device is that you loosen fat and then you move the fat to the lymphatic system, which are a series of blood vessels that don't have blood in them. They have lymph, which is fluid, potentially fat, and direct the lymphatic fluid to the major areas of the body that drain back into the bloodstream. So first, we open the lymphatic vessels. 2, we remove or separate the fat cells, and then we direct the fat cells back to the lymphatic drainage. And that's what this machine does. This handpiece here is a zonal massage handpiece that has the lymphatic drainage. The handpiece that's the larger one is the one that delivers the ultrasound. Ultrasound is basically sound waves concentrated that cause vibration of tissue. The vibration of tissue causes small air pockets to get larger and larger. They get between fat cells, and what we call cavitation separate fat cells from other fat cells through cavitation. Once the fat cells are by themselves floating in a little fluid, this zonal massage handpiece will direct that lymphatic, that fatty tissue into the lymphatic drainage system. So that's how this machine works. Part of the treatment is the measurements and photographs. After that is completed, what we want to do is open the lymphatic drainage. Okay? Every body has a lymphatic drainage. From about the belly button or umbilicus downward, the abdomen and hip area drain into the inguinal lymph nodes, which are on either side of where the thigh meets the abdomen. The superior part of the abdomen will drain up to the axilla or the main drainage of the nape of the neck area or the superior chest. So that's the setting we're going to do. This has 2 transducers, 1 and 2. Both of these transducers are delivering the ultrasound. The ultrasound has to be delivered with the probes touching the patient's skin for minimal discomfort. Okay.
You can definitely feel it not going to speed.
Okay. Am I hurrying you up?
No.
Okay.
Is it hot enough yet?
Well, it's just starting, so it's going to... I'll try to stay away from your bone, which is right there. Okay. So he started...
So we're just stimulating lymph nodes again and draining all of the fluids. Wow.
Okay, I don't want to compress it too much. So is that nice and loose?
Yeah.
Yeah.
Okay, so that's there. So it's 87.
Okay.
So again, right at 87. Okay. So back. Yeah, it is.
Isn't it?
So it's almost the same thing. It's almost exactly what it is there.
You know what I think it is?
So
I
this
think
is-
it's the skin tightening too.
It's, I would say 87.5, you would agree?
Yeah.
Okay, right here. Not pulling tight. Let's actually give him the benefit of the doubt because I'll put it at 88, okay?
Okay.
That's pretty loose still, right?
Yeah.
Okay, if you want to do it loose. So that's at 88. Comparing to before, as you examine Jonathan now, his skin of his abdomen is much tighter. You can see that from photo documentation. And the skin appears to be less redundant. The next thing we want to look at is, was there a circumferential reduction in the diameter of his hip and abdominal area? So what we're going to do is we're going to measure that. And now we're at 80. Let's just say, I'm putting no tension on this, 86 centimeters. So now we will go to the bottom part, right above the iliac crest. Here's his hip bone right there. So make sure it's symmetric on the other side. You can see he's, if I relax a little bit, that's about the same thing, about 86. So that's what we'd expect. Okay, now we go to the middle part. This is the part that you'd expect the biggest change. Why? That's where most of the fat is. You have bone on your ribs, you have bone on your hip. You're not going to reduce the bony protuberance of your body. So this right now is about the same. So this is about, again, we're trying not to have any tension. So if we wanted to do it, it's a little less than 86 centimeters. I'm not aware of any non-invasive machines that can currently give this type of result. So this technology called VaserShape, which was recently FDA approved about 2 months ago, shows that with just myself as well as other colleagues, that from a non-invasive technique, there is a significant improvement. As we've videotaped photo documentation of his improvement, the advantage of this technique as well is during the treatment, except for generating some warmth and heat, is fairly non-painful. If you look at the other technologies that Syneron has as well as endermology, it's very uncomfortable to go through.